Hello, this is Andre with Tongue Tales on Monday, and today's tale is about the tongue of a person suffering from chronic anxiety and insomnia. Now, let's see what her tongue would tell us. Now, let's observe the coating of this tongue. You can see that this coating is dry, white, and it has kind of rough quality to it. And that indicates fluid depletion. Typically, this is a complex scenario that involves both the stomach and spleen Qi deficiency, resulting in accumulation of turbid dampness. Spleen Qi deficiency results in accumulation of turbid dampness. On the other hand, the deficiency of stomach Qi results in the stomach not receiving adequate moisture. Thus, tongue coating looks dry and rough. So the tongue moisture is lacking, and there is also dryness of the lips. So we are definitely dealing with stomach dryness here. Now, the size of the tongue is slightly enlarged, and it looks slightly swollen as well. So definitely, and also there are minimal, here you can see minimal teeth marks, a further evidence of spleen Qi deficiency and accumulation of dampness. Next, we observe a long vertical crack extending from the middle 1/3 all the way to the tip of the tongue. And this is indicative of the constitutional weakness of the heart. Now, in the absence of red tongue color, we rule out the possibility of heart fire. Constitutional weakness of the heart does not mean an organic weakness of the heart. This type of constitutional weakness of the heart typically manifests as a certain kind of mental or emotional weakness, frequent attacks of crying, melancholy, emotional instability, fearfulness, and depression, maybe sometimes even insomnia. But next we want to observe the tip of the tongue, and you can see the tip of the tongue is also slightly indented here. And in the absence of redness at the tip, this indicates blood deficiency. The color of this tongue is pale blue, which indicates impairment in blood movement, most probably from the insufficiency of Qi. When there is insufficient Qi energy, the body lacks the resource to move blood properly, resulting in blood stagnation. We already established that the gate of vitality, the warming yang Qi of the kidneys, is not reaching the heart because the tongue does not have redness at the tip. Now we have further evidence that the kidney yang also fails to move blood, resulting in blood stagnation. We should ask this patient whether they have any painful syndromes, because usually blood stagnation is associated with painful syndromes. And then we'll have a better idea of what herb would be the best for her to move blood if necessary. Next, let's take a look at the sublingual veins. And we can see that sublingual veins seem to be unremarkable. That's a good sign. The severity of blood stagnation might not be sufficient to cause visibly dark blue sublingual veins. And so the absence of distended sublingual veins is a sign of a milder form of blood stagnation. Perhaps we will not need to focus on invigorating blood as a separate strategy. Now, let's unpack it. We are dealing primarily with spleen Qi deficiency leading to blood deficiency in the heart, which results in disturbance of Shen Spirit, and as a result, this patient feels anxious, and they are also unable to fall asleep. And so the ruling formula for this patient would be Gui Pi Tang, restore the spleen decoction. Specifically, we are interested in the following herbs. We want to use Ren Shen, Ginseng, Bai Zhu, white Atractylodes, and Fu Ling to strengthen the spleen and drain dampness, because this is the root of this problem. Also, Ren Shen and Fu Ling have the ability to restore Shen Spirit, and so these are very good calming herbs. They're going to also help with the insomnia. The next group of herbs in this formula are Dang Gui, Angelica Sinensis, Suan Zao Ren, Zizyphus seeds, and Long Yan Rou, the Longan Fruit. These herbs nourish blood, and specifically they nourish heart blood. And so this is the essence of this formula that nourishes blood and calms Shen. These herbs will help person to navigate stresses and cognitive dissonances much better, and they will also help this patient to have better sleep. Next, this formula has the herb Yuan Zhi, Polygala. This is also a very excellent herb to calm Shen Spirit and to help with insomnia. However, it has a different feature. It's a drying herb. It dries turbid dampness, and in combination with Fu Ling, we are going to take care of the turbid dampness aspect of this disorder. And these two herbs, just like I said, in combination, they are also very good for calming the spirit. However, we also want to modify this formula, and so we are going to add the cinnamon bark, Zhou Gui. This herb warms the gate of vitality, because remember, we need to have this extra yang energy to generate qi in the spleen and also to move blood. And so this herb is excellent at doing both of these things. And finally, we also need an herb to nourish stomach fluids, and the best fit for this particular presentation would be Mai Men Dong, Opiopagonis. This herb nourishes stomach yin, generates stomach fluids, and it also has influence on Shen. It also calms Shen Spirit, and so it's also going to be a very nice calming herb. And so you see this formula has the transformative qualities. It's going to invigorate blood, generate blood, nourish blood, and it's going to be a very calming formula for this patient. And so this concludes presentation for today. Now, if you suffer from anxiety or insomnia and would like to know what your tongue tells on you, please send us the image of your tongue and we'll speak about it next. I am Andre with Tongue Tales on Monday, and I will see you next Monday.